Good morning, good morning. What's on my mind? I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is the Daily Medical Tidbit. Thank you for supporting this, and we need to continue to educate each other. I will be moving all the videos that I've created onto YouTube also, and continue to post them on social media so we have a repository of this information. I want to talk about ovarian cancer this morning, and ovarian cancer is the fifth leading cause of cancer among women worldwide. Okay, and it's considered the most lethal gynecological cancer. All right, I know the U.S. data. The U.S. data is about 20,000 new cases a year. All right, with about 13,000 deaths. All right, so it's a real issue. And among black women, all right, the incidence is slightly lower, but the mortality rates are higher, just as I mentioned for breast cancer. All right, the 5-year survival rate for ovarian cancer is just about 50%, maybe lower, right? But as the overall, but among black women, it's closer to 35%. All right, so there is a disparity in diagnosis, and there's a disparity in treatment access. So we have to be cognizant of that. Okay, if I mentioned genetics yesterday with the breast cancer, and BRCA1, right, carries a 40% lifetime ovarian cancer risk. So if you have a family history, mother, grandmother, right, you have to rule out these genes BRCA1, BRCA2. BRCA2 is about half that time, about 20% lifetime risk of ovarian cancer. Okay, so again, I will reiterate that these mutations increase your breast cancer risk and your ovarian cancer risk. So dual cancer surveillance is important, right? And in black women, BRCA mutations are historically under-recognized, right? Genetic counselor is not offered, right? Because there's systemic inequities, right? So there's studies that show that black women with BRCA1, this genetic mutation, are less likely to undergo prophylactic surgery. And prophylactic surgery, for those who don't know, is removal of your fallopian tubes and your ovaries, right? And then that leaves them at a higher risk for advanced disease. All right. So what are the risk factors? Reproductive history. I mentioned nulliparity, which is not having babies, right? Early menarche, which is early period, late menopause. All these things increase risk. You know what's protective? Pregnancy, breastfeeding. All right. These things can be protective and oral contraceptive to a certain degree. We have to talk about the lifestyle factors. I talked about obesity, high-fat diets, okay? Now, there is some link to endometriosis and pelvic inflammatory disease. Right? That shows that there could be a link to higher risk for ovarian cancer. We cannot downplay family history here, okay? So if you have a family history, I mentioned before, of ovarian, breast, or colon cancer in your relatives, that should raise your suspicion. The presentation, the signs and symptoms, it presents late, and that's why it's advanced. But one of the key things is vague abdominal pain, but the abdominal bloating, the distension, which is mistaken for weight gain, I always say that. You have to look for that. If your belly is getting really bloated and distended, and just in that area, you want to work that up for ovarian cancer. All right? Urinary frequency or urgency mimicking bladder infection, fatigue, back pain, these are kind of vague. But as you develop ovarian cancer, ascites, which is the fluid in your abdomen, start to build up, right? And by the time you get to that point, you're already in the advanced stages because ovarian cancer spreads directly into your abdomen. Okay? All right? So because these symptoms might mimic your gastrointestinal or urinary problems, we tend to dismiss it. So by the time you diagnose, you're stage 3 or stage 4. All right? So please be cognizant of that. Get the ultrasound. If you need to get the tumor marker, get the tumor markers, the CA125, right? Right, CT, MRI. And that's why it's important. We can walk as much as we want with our t-shirts and everything else, but we need the facility, we need the staff, right? We need to have all these things. So in terms of, diagnosing, the CT, the MRI is available, transvaginal ultrasound should be available, right? OB/GYN doctors should push for these things, right? That's why sometimes privatization should be done, and the banks need to support these young doctors who are trying to make a difference and give them the loans to get this equipment to put in their private practice so they can service these women. These things are very, very, very important. Okay, and for the pharmacy and the doctors and the hospitals, look into the chemotherapy. I know that everyone wants to go, homeopathic and things like that, but these medications have been proven, right? So there's a whole slew of them. I'm not going to get into them. There's a lot of research going on in those regards, and they can save lives. This is important. This is crucial, and me talking about it is one thing that raises awareness, but for us to have the facilities to take care of the women, I think is very, very, very important, right? And then beyond that, the supportive care, the palliative care, right? How do you manage somebody who has a lot of fluid in the belly or develop a bowel obstruction? These are important things to know. We need to break the barriers. These health disparities in Black women that cause them to be diagnosed later. We need to break those. We need to break those chains, and it's important. All right. I just wanted to bring that out there, and know that educate your patients, because many people will say, no, I don't want surgery. Survival is better when surgery is done, especially if it's done by a gynecological oncologist, right? In specialized areas. Let's develop these things for ourselves and break down the socioeconomic barriers, all right? So I just wanted to put that out there so folks can truly understand a little more about this and be more aware, be more cognizant, right? Once you get to stage 3, stage 4, your survival is between 10 to 40%, all right? All right, that's what I wanted to bring forth today. Have a great day. Peace.